The enteral feeding pump that we have is called the Ross Patrol enteral feeding pump. So we'll be doing a review on how this infusion pump works. Is our enteral feeding bag. So this is what you're going to fill up with the prescribed formula. So this bag must be replaced every 24 hours. You can rinse this bag with water in between intermittent feeding. On the package there's actually some nice step-by-step instructions that pretty well explains what I'm going to review with you today. So if you're ever tripped up, you can always refer to this quick little reference here on the bag. It comes with a label. You should be marking the patient's name, room number, date and time, the rate and the name of the formula on this sticker and placed on the bag. What I recommend for priming this is close your clamp first and then go ahead and set it in there. Don't attach anything, just set it in. Then we're going to use Boost today because that's what we have available. Pour it into the bag. You want to try and keep as clean a technique as possible. That'll just prevent bacterial contamination. Screw that on. Hang up your bag. Undo your clamp first. And then just pull. Now that will prime your line and it'll prevent the chamber from overfilling. If the chamber gets too full, it'll be very difficult to unprime what you've already primed in the chamber, but I'll show you how to do that after. Okay, so now it's primed. You want to just wind it around so it goes at the bottom of this blue circle thing, and then that blue, this is a little handle here, sits right in there, and you're good to go. Okay, let's talk about programming this pump. So first of all, we'll clear it. There's usually 4 beeps. And then it's zeros all across the screen. This volume fed is in mils and it tells you how much has been absorbed basically. So we'll have a look at that a little bit later. There's your hold button. So default is 5 minutes. You can increase the hold time by increasing this button here. So you can go all the way up, and 90 minutes is the maximum you can hold it. So go back down and we'll put it back at the default 5 minutes. There's your set dose. So set dose is how much you have inserted in the bag. We're going to go ahead and put it at, if you look at the bottle, it says 237. So we'll just round it to 200 for simplicity purposes. So this, these up-down buttons work kind of like your oven or your alarm clock. If you hold it a little bit, it will speed up for you. Now, that being said, a dose does not always need to be set. It can actually remain at 0,000 and still infuse. And you probably use that if you were using a continuous feeding. There's your rate. Sometimes the rate will be prescribed by the physician. Sometimes you'll have to calculate because it'll say to put the feeding over an hour. Let's just say we're going to infuse this at, let's say 200. Say we're going to put it in over an hour. Okay, and then you can go ahead and hit run. And you can see that it's dripping in. You can hear the pump functioning. Let that go for a minute. Now, put it on hold. So the volume fed 1 ml has been infused so far. This little pump has a battery that lasts about 8 hours. If the battery is low, a message will display low, LO, BAT, B-A-T. And then you'll have 30 minutes remaining before it will have to be plugged in. The other thing is we can lock out these dials, and how you'll do that is you'll put it to set rate, and then you'll hit the up and down arrow simultaneously, click like that, and then it'll state lock. So you can go ahead and run it, but the patient can't mess with your rate. So you just hit the button simultaneously again, and then you have use of your arrows again. So the only other thing to show you are a few troubleshooting tips. One of the biggest things is when this drip chamber gets too full, it'll just start beeping at you. So then you got to clear some of the formula out of here. I'll show you how to do that. So there you've got a way too full chamber. Hang your bag a little bit lower, which means you have to hold your tubing up a little higher. Now I just stretch, and you'll notice that it starts to go back up into the bag. And I just do it until the whole chamber is cleared, and that should do it. Keep raising it up and then lock it, and that'll prevent any more from washing back in there. And then you can start again as before. So it's in the drip chamber, and then just pull, and that will prime your line. So you would use this same priming technique if you had to rinse this tubing in between intermittent feeds. Completes